Go.
Hi, thank you all for being with me today. I have with me my grandmother Mary, my mother Donna, my cousin Brittany, and my father Robert, and my cousin Michael, who's on camera. And today I will be informing you on arthritis. Do you ever stop to think about how easy it is to complete a daily task such as brushing your teeth or opening a jar? For most of you, I'm sure the answer is no. Stop and think for a moment how difficult it could be for someone with arthritis. For those of you who may not be aware of this condition, arthritis is the inflammation of joints within your body. Considering this, would you think a simple day-to-day task for you to complete could feel almost impossible for someone with arthritis? People with this disorder have to make compromises by using something such as a hair curler over their toothbrush, a jar opener to remove lids, or a button hook to button a shirt. I have two pictures. The first being of the button hook. How this works is you would put it into the opposite side of the shirt that doesn't have the button, put it through and lock onto the button and pull it through. This is a picture of a jar lid opener. It has different sizes. What you would do is put it over the lid and it would screw easily right off. These are just a few tools available for someone with arthritis. However, there are a variety of other tools available today. There are over 100 forms of arthritis. However, today I will be talking to you about the two most common forms, which are osteoarthritis and rheumatoid arthritis. Osteoarthritis is the first form, and this is the wear and tear of your joints when they become overworked. Two jobs that could cause this form of arthritis would be an office or a manufacturing job due to the repetitive motion that comes with it. It can even appear in those who have had past injuries or injuries that did not properly heal. The second form is rheumatoid arthritis. This is an autoimmune disorder which takes place when the tissues within your body are attacked by your immune system. The synovium, or soft tissue within your joints, is what is affected and quite possibly destroyed by rheumatoid arthritis. The synovium releases a liquid in order to lubricate the joints and sustain the cartilage. Repetitive motion causes this liquid to wear away over time, leading to bone on bone, which can be extremely painful for someone with arthritis. Rheumatoid arthritis could lead to total damage of the cartilage and bone within the joints. Many people can develop nodules or lumps on the skin due to this disease. This commonly appears on knuckles, elbows, or heels. In both of these forms, there could be a genetic predisposition, which means that, say, your mother or your grandmother have arthritis, which is putting you at a higher risk of getting it. There are a variety of symptoms of arthritis. These symptoms can occur suddenly or gradually over a period of time. They appear to be more severe in rheumatoid arthritis over osteoarthritis, and they are seen actually as most intense during the morning hours of the day. The most common symptoms include joint pain, swelling, and stiffness, and some less common symptoms include decreased range of motion, inflammation in the joints, drowsiness, loss of appetite, or anemia. In more severe cases, such as rheumatoid arthritis, you can also see joint deformity. I actually have a picture of my grandmother's hands. As you can see, her fingers are disfigured, and you can see on each of her fingers and her thumb that there are nodules. Although there is no known cure for arthritis, there are a variety of treatment options, which include medications, surgery, or physical therapy. Some medications include methotrexate, hydrocodone, acetaminophen, which is Tylenol, ibuprofen, methanol cream, corticosteroids, and many more. These medications can help to control the pain, inflammation, block the spread of pain signals from the joints, or suppress the immune system in rheumatoid arthritis. Some surgeries that you could go through if you have arthritis would be to replace the joints with artificial joints, and this is commonly done in knees or hips. Another form of surgery that you could go through is joint fusion, and this is commonly performed in severe cases in the fingers or the wrists. This joint fusion surgery is when the ends of the bones are locked together and eventually become one. The last form is physical therapy. This is just when you exercise in order to assist in the strengthening of your bones, and this is necessary after surgical procedures. Now I would like to take the time to talk about two of my family members who actually have arthritis, and those would be my grandmother and my mother. My grandmother was diagnosed with rheumatoid arthritis when she was 27 until presently 87, which if you count is 50 years now. And she has rheumatoid arthritis through her whole body. She's actually had surgery on her toes in both of her feet and her right hand. The surgery on her toes, they put pins in her toes, and the surgery on her right hand, they put artificial joints into her hand. She also takes medications. Currently, she is on methotrexate, and she also takes a shot called Enbrel, which she takes twice a week. And in the past, she was given a shot by doctors, which was called gold salts. Some tools used to get through her daily tasks would be a foam hair curler on her pencils, pens, and toothbrush. But new technology today has been created for people with arthritis in order to help them get through and complete their daily tasks. So as you can see, recognition is becoming more evident in today's society. On to my mother. She has arthritis in only her hands, and she has osteoarthritis. She actually this past January had surgery on her left hand, and this surgery was called arthroscopic surgery, where an arthroscope is inserted into the joint through a small incision. In this surgery, they completely took out the bone and replaced it with a wire and screws. Now, you could actually, over time, go through another surgery in order to get the wire and screws taken out, but that's optional. Overall, arthritis can be a debilitating disease. Although at present there is no known cure, there are a variety of medications available to alleviate some of the pain that comes with this disability. With today's technology and research, we are hopeful there will be a cure in the near future. Thank you.